Welcome everybody. As you probably are noticing, you won't be on screen today. It will just be the five of us that are on screen. So there's nothing wrong with your computer. You will be able to raise your hand if you have questions and ask questions via the chat and the Q&A. And Stephen's going to go through and explain all the options and how to use Zoom and that kind of thing. So I'll start with, I'm Deborah Elmore. I'm Executive Director of the Bay Area Association of Kidney Patients. And this is our first webinar. So if we run into any hiccups, be forgiving, please. So we're lucky enough to have Marcelo Espiritu is going to be our first speaker, and he's going to be talking about Medicare in 2021. And just as a quick background, I don't know, I will be launching a poll. I guess now's a good time to ask if your experience with kidney disease with the BAAKP. I think we do have some people that are new to the Bay Area Association of Kidney Patients. So the Bay Area Association of Kidney Patients was founded in 2007. It's a nonprofit organization that is run by volunteers. And our goal is to educate and support kidney patients. We hold monthly support group meetings. We hold educational presentations, and with the advent of COVID, then we had to stop meeting in person. So this is our first educational presentation via webinar. So after the meeting, you'll be getting a survey that asks, did you like this format? What'd you think of it? Should we have more? We have a website. I'm not sure, I did ask how you heard about this, but on our website, we have videos of past educational presentations, our newsletters, and links to other kidney resources. And I think that's, we have several members of our board here on the call with us, but on screen, we have our president, Phil White. Phil waved everybody. And then we have Imelda Bilberry, who is co-programs chairman. So she helped put this together. And with that, I'd like to introduce Stephen Rubalcaba, right? And Marcelo Espiritu to tell us about the presentation today.
Hey, well, thank you so much, Deborah, for the lovely introduction. And thank you again for having us. I know we have had a partnership with the Bay Area Association of Kidney Patients. So my name's Stephen Rubalcaba. I am the Community Outreach and Education Specialist here within the HICAP program. And I've been working for SourceWise, the not-for-profit organization for, geez, it's been a while now, 10 plus years at the moment. So it's been a delight working for the HICAP program, being able to educate folks on something as important as Medicare and how to kind of handle it. So thank you for putting together that poll. I think the responses, some of those questions are going to be valuable for us to know what other targets to zoom in on. So for those of you that have not taken the poll, I think there's still a little bit of time for you to answer those questions. It looks like there's 1, 2, 3, 4 questions in that poll. Once you're done, you can click submit or okay. And to kind of get a little familiar with this Zoom environment before I introduce Marcelo to get going, if you hover with your cursor towards the bottom of the screen, you should be able to see a chat, like little bubble icon, and the word chat. You can simply click on that if you have any questions throughout the presentation. While Marcelo is presenting to us, I'm going to go ahead and keep an eye on that chat filter to answer any questions at the moment. And if we need to interrupt Marcelo to make sure that, maybe he touches or elaborates on these questions, I'll certainly do that. And there's even a Q&A button or feature similar to the chat although it's just a different way of sending us a question. So by all means, feel free to use those tools. Again, it's at the bottom of your little screen window. When you hover over it, you should see a chat and a Q&A. And again, thank you to those who did answer those polls. It looks like we just took it away. So thanks for that information. It's very, very helpful. So I think that's good enough. I think we've given, let's see, what time is it now? We got 1:05. So I think that's a decent amount of time to let folks, navigate their way into this meeting. I know me, sometimes I have a hard time. So without any further ado, let's go ahead and introduce Marcelo Espiritu, the Director of the Health Insurance Counseling and Advocacy Program, or HICAP, within Santa Clara County. So thank you again, Marcelo, for getting here this afternoon and educating us on Medicare and some of the rules that apply to the year 2021, and also specifically how it may relate to some of our kidney patients that are on the presentation workshop today. So thank you so much for joining us today. And Marcelo has a wealth of experience in HICAP, over 10 years also. The man's a genius at the HICAP and Medicare topic. So thank you, sir. And I'll go ahead and zip it up and hand it over to you. And again, please feel free to use the chat and the Q&A feature, guys. I'll be keeping my eyes on it throughout the whole time. Thank you.
All right, well, thanks for the introduction. I don't think I'm a genius, but thanks, Stephen. Thank you, Deborah. Thank you, Phil and Imelda, for having us. It's a pleasure to be back and to be your first webinar. Without further ado, let me go ahead and get started. Just kind of with an overview. Deborah showed me some of the questions that have come up. So there are a lot of questions about enrollment and eligibility before one gets on Medicare, getting into Medicare, and then I'm sure there are folks, of course, already on Medicare. We'll look at enrollment, but I have a really good fact sheet that we'll share with the group. Everything I show you will be shared, by the way, with you. And the fact sheet through the California Health Advocates really outlines some of the important points of enrollment. Even though I go through some of these points kind of quickly, rest assured that you'll have some good documents in hand. I'll talk a bit about SourceWise, and then an overview of Medicare, and then we'll look at some of the 2021 numbers. And probably the most important change in 2021 is the fact that people with Medicare can now, and ESRD, end-stage renal disease, can also join Medicare Advantage plans for the first time in Medicare history. There's some exceptions where people could be in them if they were with an employer that had an insurance that also had a Medicare Advantage. So we'll go into those and compare Medicare Advantage and the other side of Medicare, what we call original Medicare, with possibly a Medigap. Okay, let's begin. First of all, SourceWise is here to help seniors age well at home. As Stephen mentioned, we are a private nonprofit. We are the county, Santa Clara County's area agency on aging. We've been that for I think over 40 years. And we provide expertise, education, and quality support services to Santa Clara County seniors, their families, and caregivers. And we do this in different ways. We receive grant monies through the Older Americans Act, and we distribute that money to different organizations in our county that help us meet our goal here. We also have direct services, and we have the information and awareness program. So if you were to call us, and our numbers will be showing up shortly, you could ask them for any other resources that you might need help with, and they can refer you to different organizations and services. We have a care management program. This is also known as MSSP, Multi-Purpose Senior Services Program. It's for people who have Medi-Cal, which is California's Medicaid program, and it provides care management services. We also have a senior employment program for people 55 and older who are trying to get back into the workforce. We help subsidize the salary with the hope that the hosting agency maybe picks them up, or they just develop, and hone their employment skills. We also have Meals on Wheels at SourceWise. This is for people who are homebound and cannot provide meals for themselves. Because of COVID, we have now several meals programs, not just for people, older adults, but also younger than that as well. So contact SourceWise if you or someone needs help with meals. And Stephen and I, of course, are with the Health Insurance Counseling and Advocacy Program, also known as HICAP in California. We are part of a national network called the State Health Insurance Assistance Programs. We're the local source of help for people with Medicare. Every state has a program like ours. It might be named something else, but every state works with each county, and there should be HICAP type representatives who can help you. We're primarily volunteer-based, although we have staff and volunteers who are counselors. And we're here to provide free, objective, and safe Medicare counseling during the COVID pandemic. Normally, we meet face-to-face, but now we're having appointments over the phone, or if people are capable or have the technology through video chat. This is our phone number where we can be reached. You can leave a message and we'll get back to you to set up an appointment. I understand there's some folks who are out of the county. If you're in another county, you can call the state number, 800-434-0222. That line is administered by the Department of Aging in Sacramento, and this is their website. If you go to aging.ca.gov and you search for the HICAP program, you'll be able to find a link to your particular county as well. The phone number, 800 number, will route you to the county that handles your area code of your phone. So I have a 510 area code on my cell phone, but I live here in Santa Clara County. That's why I provided the link to help you if you need to contact them, maybe through using the Department of Aging website. Other people in other states can contact their local SHIP by going to medicare.gov. It's a very good Medicare website. And under contacts, if you search for your SHIP program, you'll be able to find the information you need to get local help with the options in your county. Our program works again through volunteers, and we station them throughout our county. These are some of the sites that we partner with to provide one-on-one free Medicare counseling. And you can contact us numerous times. We're here to help you understand Medicare and come up with a good option for your situation. Again, please use the Q&A for some questions. We'll address them at the end. Hopefully I'll get to answer a lot of them through the presentation. So just as a general overview, Medicare, it's the Social Security Act, Title 18. So it is law, and it describes the federal health insurance program for citizens or people with 5-year continuous permanent residency. And then after you meet that hurdle, there are 3 main groups that Medicare applies to. So people 65 and older, people under 65 with a disability, according to, it's defined by Social Security. And then at any age, one with end-stage renal disease. So the gateway into Medicare starts with Social Security. After that, Medicare is administered by CMS, the Center for Medicare and Medicaid Services. It is the law, and I bring that up because people think that these parts are things that you need all the parts, but really it just talks about the law. So Part A, started in 1965, described what we call hospital insurance. Part B was written at the same time, and it describes what we call medical insurance. Back then, they were sort of separate insurances, unlike today where suppose you're with an employer, you sign up for insurance, there's no distinction between hospital and medical coverage. But in the Medicare program, you should get used to the fact that there are different parts that describe different coverages. Part C, sort of during the introduction of private insurance into Medicare, was written and describes what are called Medicare Advantage plans. These are, private way to receive Medicare benefits A and B, but through a health plan. In our county, Santa Clara County, most of these Medicare Advantage plans are HMOs, health maintenance organizations. The quintessential HMO being something like Kaiser, so that was started, and so it's a different way to receive and access benefits. Okay, and then in 2006, outpatient prescription drug coverage was introduced, and that's described in Part D of the Medicare law. Now, coverage for people with end-stage renal disease started in, based on the 1972 public law. So it didn't start right away, but it was written into the law. Now let's look at the cost. What does it cost to have Medicare? What are the premiums? So let's look first at Part A and Part B. So Part A is typically free for most people. When it's not, it's based on FICA taxed work history of either yourself, your spouse, or a family member. And your work history sort of is one aspect of determining eligibility and the premium that you might pay. Part B, on the other hand, is not paid, it is paid by everybody, whether out of your own pocket or maybe through a state program if you have low income resources. Currently, the Part B premium is $148.50 per month per person. That's the what we call the standard rate. It can be higher if your income is higher. The Social Security and the IRS, they communicate. I should say CMS and the IRS, they look at your most recent tax filing. So to set this year's premium of 2021, they're looking at the 2019 modified adjusted gross income. And you can see, I'm not an accountant or tax person, but that's where you would be able to figure out your what's called MAGI or MAGI. Now, back to the Part A premium. Again, as I said, for most people, it's free. In fact, if you qualify for Medicare due to end-stage renal disease, your Part A premium will be free. Essentially, Social Security has said, well, you meet our requirements, like either you or your spouse or family member met the work requirement. So you get Part A for free. If you have Medicare due to a disability, it's also free. You met the work requirements and it's $0 per month. Those, however, who age into Medicare at 65, most of them have $0 premium Part A. But if you haven't worked and accumulated what are called Social Security quarter credits, as you can see, the premium's not fully subsidized, and it could cost as much as $471 per month. We have some clients who are at the 38 to 39 credit range, paying $259 per month. If they can find a way to work and earn 1470, then that would give them another credit this year. And you can get 4 credits max per year, or 1/4 credit is worth 1470 in earnings. Now back to Part B. As I mentioned, it can be higher than the base rate of 148.50. If your income, if you file individually, is more than 88,000, then you'll have an adjustment upward of 59.40, totaling $207.90 for your Part B premium, and it goes up from there, as you can see. If you're receiving Social Security payments, then this is typically deducted from your Social Security payment. Now, sometimes people, so you kind of have to plan ahead when you're looking at what you'll be paying. If you lose work, most people retire and then their income goes down. Social Security says, okay, you've had a life-changing event, let us know, and we will adjust your Part B premium based on your estimated earnings for that year. So it can be adjusted. So just read your letters and look out for that. If you have if you move to a lower bracket because of divorce or again, loss of hours of work, etc., your Part B premium could be lower than what it normally might be. There are some programs that help people pay the Part B premium. One of them is Medi-Cal, California's Medicaid program. If you have what we call full or free Medi-Cal, where you don't have a share of cost. In other words, your income, your countable income is below the cutoff, then, which is now 138% of the federal poverty level. And you meet the asset test. So as a single person, you need less than $2,000. As a couple, you need less than $3,000 in assets. If you qualify, the state will pay your Part B premium. So that's quite a big savings. If your assets are a little higher, there are programs called Medicare savings programs. We call them QIMBY, SLIMBY, QI. Their purpose is really to pay for the Part B premium as well. Although QIMBY is a program with very low income limits, 100% of the federal poverty level. It's the only program that may pay for the Part A premium. Well, there's another one, but that's the main one. Now, if you have either of these Medi-Cal or Medicare savings programs, you automatically get what's called the Extra Help Program for Part D prescription drugs. It's a program that really lowers a person's drug premiums, drug plan premiums, and costs. And that happens automatically. Now, let's look at eligibility for Medicare. Again, we talked about those 3 groups. If you have a disability, I'm sorry, not under 55, but under 65, it starts at the 25th month of your SSDI benefit payment. Okay, so there's sort of a delay if you have Medicare due to a disability under 65. You can have Medicare again due to age, and it starts no earlier than the first day of the month you turn 65. Okay? Now, keep in mind, an individual with ESRD can start with what's called ESRD only Medicare. And then later, if they apply for disability, they could also have Medicare due to a disability. And then later on, Medicare also due to age. I bring this up because, especially for age, when you age into Medicare, it opens up additional opportunities, rights to get other supplements. And we'll look at that later on. So now let's talk about how do you become eligible for ESRD Medicare. You have to have stage 5 chronic kidney disease, and you've worked a certain number the required time according to Social Security, either you, your spouse, or your family member. Maybe you have, retired from the Railroad Retirement Board or a government employee, but you met the requirements. If you're already getting or eligible for Social Security or Railroad Retirement benefits, you may qualify that way. Your spouse or dependent who meets either of the above, and then of course you can get ESRD Medicare at any age as well. When would it start? So it's a little different than the other two, but there are different situations under which ESRD will start. So the first one, when you're getting regular dialysis treatments in a facility, Medicare could start on the first day of the 4th month. So after there's a waiting period. It could start on the first day of the 1st month when you participate in home dialysis training and meet the training dialysis conditions. So in that way, you can start it earlier. When you get a kidney transplant, it would start the first day of the month when you get a kidney transplant. It would start the first day of the month when you're admitted to an approved transplant facility, if that facility transplant takes place in the same month or following 2 months. And then sometimes things are delayed. So it could start 2 months before the transplant, if the transplant's delayed. Some folks are wondering when ESRD Medicare would end. So it would end 12 months after the month you no longer require a regular course of dialysis, or 3 years, 36 months after the month of your kidney transplant. So if you've had a successful kidney transplant, then Medicare will end. It will be considered successful after 3 years. Now that's important because Medicare covers a lot of transplant medications. There was a proposal that didn't make it into the what's called the Benny's Act. There was a proposal to extend Part B immunosuppressive drug coverage after 3 years, but unfortunately that didn't make it. There are conditions when Medicare can continue or resume or restart. So let's say if you continue regular dialysis treatments, or you start dialysis again within 12 months after your regular dialysis stopped. Also, if you have a kidney transplant or a regular course of dialysis starts within 36 months after transplant, or if you receive another kidney transplant within 36 months. So conditions for ESR to resume or restart, sometimes you're off Medicare, but if you start a regular course of dialysis again, or get a kidney transplant more than 12 months after you stopped, then it can restart. If you have another kidney transplant more than 3 years later, you do have to file again. And for those who are working, there's what's called a 30-month coordination period if you have an employer group health plan. And I'll talk a little bit more about that. I believe some folks are in such a situation. Okay, so talking about just having ESRD only Medicare. There are situations, where people are working, they have employer group health coverage or an employer group health plan. And there are rules about who pays first and who pays second. The insurance that's primary covers the bulk of the payments. And these are by statute. So there's what's called a Medicare secondary payer, 30-month coordination period. So the employer plan is always primary for 30 months. That's about 2.5 years. Um, um, Medicare is secondary if a person signs up for Medicare in that time. But after the 30-month, Medicare becomes the primary payer and the employer group health plan becomes secondary. Now, when we think about employer group health plans, oftentimes we think, okay, I have to be working and I have that coverage, but by definition, it also includes COBRA. So when you lose your job, you can continue with that employer plan under the COBRA rules. So a lot of people call that COBRA coverage. Sometimes you get employer coverage as a retiree. And so we group all of those. When it comes to ESRD only Medicare, we consider all those employer group health plans. So this 30-month of coordination where the employer group health plan is primary, whether you sign up for Medicare or not, this 30-month coordination period is being tracked. So you really need to know when that 30-month period is coming, because once it's over, Medicare becomes the primary payer, and if you don't have it, then you could be out of coverage. So you can enroll in Part A and B anytime during this 30-month coordination period if you have an employer group health plan. The recommendation that we've seen is if you enroll in Part A, you always have the option. You can enroll in Part A. If you don't enroll in Part B also, you can only enroll in Part B during a specific time. It's called the general enrollment period, and that's January through March, and it won't start until July. So there's a fact sheet that we're going to pass out that really describes this. And according to the fact sheet, one of the strategies is really don't enroll in A and B, or enroll in both A and B together. Don't defer Part B because you might face late penalties or delays in coverage. These are some other rules about when you have both Medicare because of ESRD and Medicare because of disability, or you're aging into Medicare. These are some specific situations that that we can talk to you about if you're in those situations. But just know that turning 65 is a big deal. Some of these ESRD rules and timing and penalties go away when you turn 65 if you're late, that is. One important aspect of this is that you can sign up for ESRD Medicare A and B, and it can go retroactive up to a year, as long as you're signing up for both at the same time. So let's say you're in this 30-month coordination period and you have really good employer coverage, but you're about to have a transplant soon. Maybe you want to start A and B. You can do that together. If you missed it, if you got the transplant, but not A and B, you can always go back and sign up for A and B and have it start so that it covers your transplant. But again, you have to do them together as a pair. This is just a chart which you'll have showing who's primary, who's secondary when you have an employer group health plan. Now, why might you want Medicare during your coordination period? maybe the employer group health plan doesn't cover all the medical expenses. So Medicare might be able to help pick up those out-of-pocket costs. Or maybe you're getting a transplant soon and you need help with the immunosuppressive drugs. Well, Medicare will only help if you had Part A when you had your transplant. So that is another reason to maybe consider getting Medicare in the picture during that 30-month coordination period. As I mentioned earlier, enrolling in Medicare is through Social Security, but of course your physician has to fill in his or her portion as well, attesting to your ESRD condition. Now, when you have Medicare, there are still out-of-pocket costs, co-pays, deductibles, different ways to handle that. Again, your employer group health plan could help. There's also something called the Major Risk Medical Insurance Program, Mr. MIP in California. It's kind of expensive, but it does, you are allowed to join it, and it would pick up out-of-pocket costs. And it does coordinate with Medicare, meaning there are rules that say who's first, who's second. Medi-Cal will help a lot with Medicare. It basically eliminates all of the out-of-pocket costs of Medicare. Medigap plans in California we'll look at. And then in California though, unfortunately, if you're under 65 and have end-stage renal disease, there's no requirement for companies to sell you a Medigap supplement plan. The rules vary by state, but we aren't there yet in California. However, when you turn 65, it's important to know that you can purchase a Medigap supplement to offset the out-of-pocket costs with original Medicare. You get a 6-month period to do that. So that is a very important time to keep in mind when you turn 65. It gives you more options. And what's new in 2021 is the ability is Medicare Advantage plans are now open to people with end-stage renal disease. This has not been the case for, since the Medicare, since the 70s when it was covered. So we'll look at that. Okay. So now let's look at the 2 ways to arrange your Medicare. Okay, essentially 2 paths. And we'll call them original Medicare. We'll look at that. On your right, you can see the red, white, and blue card. It has Part A and Part B, the effective date. And to that card, you can add what's called a Medigap supplement and drug coverage. And some people have that. I'd say about 70% of the country has original Medicare as it was set up in the beginning. And then we'll look at the other ways. Now, just as a side note, some folks have retiree or union plans and they're over 65. A lot of these retiree union plans are approved by Medicare and they look like maybe a Medigap supplement with Medicare, or they act like a Medicare Advantage HMO. So you can have Medicare and then a retiree plan that looks like a Medigap, or it looks like an Advantage plan. Okay, so this will help you understand that a bit more. Okay, so let's go down the original Medicare path. Who can you go to when you have original Medicare and you've decided to, stick with that and use that? You can go to any practitioner or use any hospital, nursing facility, home health agency, hospice agency that is enrolled in the Medicare program, that accepts Medicare, not just in the county, but in the entire United States. Okay, you can take that card with you anywhere. You can use telehealth and set up an appointment to talk to a doctor in another state if you need to. You may need some referrals, but it's possible. The overarching rule for what Medicare covers is that it be medically necessary and reasonable for your situation. Everything that's covered is actually laid out, and the folks, Medicare contracts with what are called what are they? I'm sorry, I forgot. They're contractors who hold the lists of what's covered, what's not. Sometimes they are a little more generous in certain locales than others. Now, using Original Medicare, it's not an HMO. It's not, you don't need a primary care doctor who manages your access to specialists. You could have doctors in different medical groups. You're not assigned to one particular group. That is how you use Original Medicare. The strength, again, of Original Medicare is just having access to the different doctors that you might need. And since you might need a lot of services, this could be very important for you, access to the doctors in different locales, specialists, etc. Here's what Medicare, and we call this a fee-for-service Medicare. Part A and B, this is showing you what the coverage is under these different parts. So Part A covers you when you're admitted into the hospital and you have the designation as an inpatient person in the hospital. Then Part A kicks in. It covers a skilled nursing home stay after a 3-day hospital stay. If you aren't in the hospital as an inpatient for 3 days, then Medicare won't cover your skilled nursing home care. So there are now laws and requirements that say, you have to be informed of how long you've been an inpatient or you're expected to be an inpatient. Part A also covers home health care after a subsequent inpatient stay in a hospital or skilled nursing facility. And then it covers hospice, where one's considered to have 6 months left to live. A person can go on or off hospice at any time. And in our area, we don't have hospice locations, but there are agencies that help with, pain management and counseling and the such. Part B covers what are called, outpatient services. It covers all physician services. So if you're an inpatient in the hospital, the doctor bill will be through Part B. There's some preventive services now. Included in that is what's called an annual wellness visit. So you can sit with your doctor, ask for that by name, and then your doctor can set up a plan of care with you. When you get that when you first join Medicare, and then every 12 months. Preventive services are very outlined. It doesn't cover all, but they're very distinct. A lot of screenings are now free. Part B also covers home health care. So in order to have home health care, you need your doctor to prescribe it. You need a plan of care. It has to be intermittent. It can't be every day, otherwise you'd be in a skilled nursing facility. Talk to your doctor about, if you need home health care. It needs to be done by a skilled nurse, skilled therapist. Again, it can't be every day, just intermittent. And by home health, we're not talking about personal care services, things that help with your, moving, eating, changing, getting in and out of bed. Those are called personal services. Used to be called custodial care. Medicare doesn't cover things like that. It may be in a small instance where, maybe you need help bathing after a hip. You broke your hip, you need therapy. Those personal services can only be combined if you're under some type of skilled therapy, like physical therapy. Part B covers your diagnostic tests, and then therapy and durable medical equipment and supplies. Now keep in mind, when I say covers, I mean Medicare pays its portion, but you do have deductibles and copays under original fee for service, and these can add up. There's no limit to these deductibles and copays. So in the 70s, well, we'll get to that. There are ways to cover those. What does ESRD Medicare cover also? So everything I talked about, dialysis services, inpatient or facility, home dialysis, equipment and supplies, covers a transplant and transplant preparation coverage, full cost of donor care. Okay. It covers the immunosuppressive drugs and medical nutrition therapy. Medicare doesn't cover certain things like a long-term stay in a nursing home. It covers up to 100 days. It doesn't cover routine services like routine dental, dentures, routine vision, cosmetic surgery. It never covered acupuncture until recently. It helps with low chronic back pain. Hearing aids aren't covered by Medicare or exams for hearing aids, and it doesn't cover care outside the US. It covers you, let's say, 6 months to and from port, you're on a cruise, and then maybe on the way to Alaska. And if you're on the border, the closest facility is in Canada or Mexico, Medicare might cover. Those are not covered. As far as ESRD, it won't cover paid dialysis aids, lost wages, housing during treatment, blood for home dialysis, non-treatment related medications, and again, the other things that original Medicare doesn't cover. Now, just to give you an idea of some costs, Part A, the largest cost is what's called the hospital deductible. And this year it's $1,484. Whether you stay 1 day or 60 days, that's what you pay. If you stay beyond 60 days, then there's a copay of $371 per day. And beyond 90 days, there are reserve days at $742 per day. That's a lot. I think I've met one person who's been in that situation. But beyond 150 days, there's no more hospital coverage. If you have a 3-day inpatient stay and then later need skilled nursing facility, then Medicare will cover the first 20 days. And then the next 21 to 100 days are at $185.50 per day. So, and after 100 days, Medicare stops covering. At least the stay. You could still get Part B services there, but the facility costs aren't covered by Medicare. So as you can see, these are some Part A costs. Part B costs are what we normally hear of as the 20%. So you start paying 20% of what Medicare says the cost of something is after you meet your annual deductible. Part B annual deductible of $203. Okay. And if Medicare says the physician visit is $100, you pay $20. Medicare pays $80. If the durable medical equipment is $1,000, you pay your $200. Those are the A and B out-of-pocket costs. Okay. And like I said, in the course of a year, these can add up and there's no limit, which is why you would need some type of supplement to help cover those out-of-pocket costs. So Medigaps were designed to do that. Again, with original Medicare, you could have A and B, a Medigap, and then a drug plan, which we'll talk about later. But let's look at Medigap supplements first. Supplement, you know you have a supplement if it says Medicare Supplement Insurance on your card. Okay. They're sold by private companies. They can still use health screening and not sell you one. They pay the gaps in original Medicare, and there are now 10 standardized plans. Before it was kind of the Wild West, but now these plans, A, B, D, G, K, L, M, N, C, and F, are well defined, and there's a chart that I'll show you about what they actually cover. You have to have A and B, or at least enrolled in them, by the time the coverage starts in order for the plan to start. Okay. Now, as I mentioned earlier, if you're under 65 with the ESRD, you probably aren't going to find a company that's going to sell you one. But again, at 65, things open up. So this is a matrix that shows what Medigap plans cover, arranged from A up to N. C and F were kind of carved out. They're still available for people if you were eligible for Medicare before 2020. And you can get those if you were eligible before 2020. The reason they carved these out was you can see the two dots that are circled. Those plans cover that $200 Part B deductible. Congress said, well, we don't want people to not pay upfront for things. We think it'll, limit excess use. Now, whether you agree with that or not is one thing, but it is what it is. So now the Plan G is the most comprehensive plan for most new Medicare folks. As you can see, it has all the dots except for those, the deductible. There is a high deductible G plan, meaning once you pay, I think it's over $2,000+ in out-of-pocket costs, then it covers everything after that. On the far end is the Plan A, but all these Medigap plans give an extra 365 days of hospital coverage, which can't be had anywhere else. So that is one nice benefit. Some of them cover foreign travel. Some of them cover what are called excess charges. As you can see, this line here, only 2 of them do, and the G plan does. An excess charge is, some doctors agree to take a lower Medicare rate. And in exchange for that agreement, they can charge some, on a case-by-case basis, an extra 15% above the Medicare rate. When it comes to durable medical equipment, there's no limiting charge. They can charge even more than 15%. So this one benefit is quite useful if you anticipate having durable medical equipment issues. It will eliminate the out-of-pocket cost completely. And then we have things in between. We'll take a look at sample rates, but our chart is just based on our office zip code. But if you go to the Department of Insurance, insurance.ca.gov, if you click on Medicare Supplement, look for the sample rate, and then you can put in your zip code and your age, and you can get an estimate. Now, keep in mind, if you're under 65, your rates are going to be really high compared to those who are 65 and older. So let me take a moment to just look at this. Let's see. Okay, so let me share this. By the way, this is the fact sheet that we'll send out. Medicare and people with end-stage renal disease. It's a really good document through California Health Advocates, and it helps understand coverage, eligibility, and timing of enrollment. Okay, so let me let me go to this. So again, these are just the various out-of-pocket costs of Part A and Part B. Now here's the inpatient deductible of $14.94. The copays and Part B is the 20%. Let's look now at the Medigaps. Okay, so here's that chart again. And you know, how much does a Medigap cost? For someone age 65, you know, let's look at the G plan. You can see that it varies by age. So if you're under 65, you're looking at the gray column. And here, just in this plan alone, $302. If you're 65, that goes down to $141, okay? Now, you can also see that the price really varies by company. 141 versus 129. Why would you pay 141 when you could get the same thing for $129? So our rule of thumb is look for the Medigap that, you know, pick your plan, coverage, and find the company that pays or charges the lowest. So if you're under 65, let's go down here. I've circled a few that have the lowest copay. So HealthNet 289 for someone under 65. But if you're under 65, sorry, with ESRD, you can't get this. So it's really people who are 65 and older that this applies to. You know, depending on your age, typically, you know, United Healthcare has some of the lowest rates. And by the way, we aren't affiliated with any of these companies, but you know, check out your rates, and we can help you sort of understand what kind of coverage you're looking for. Okay, let me get back to a presentation. Okay, on to drug coverage. Actually, let me go back. One thing I want to mention is that if you're working still and you lose your employer plan, you can get a Medigap plan without any underwriting. Of course, if you're over 65 here in California. Every year on your birthday also, you can switch Medigap plans without underwriting. So it's a good time to look, you know, right before your birthday, start looking at costs, and you can switch to a plan of equal or fewer benefits without underwriting. Now, drug coverage is what we call Part D. With original Medicare, you get a separate card. There are different plans. They vary by premium. You know, some are as low as $720, some as high as $1.30. There are deductibles, and if you don't sign up in time, you could face a late penalty when you do sign up. If you have other drug coverage, then you don't have to worry about the late penalty if it's creditable, as good as Medicare's. Like Part B, there's an adjustment upward when you join a drug plan if your income is higher. And the best way to find a plan is to go online to medicare.gov, and you can enter your zip code, your list of drugs, your pharmacy, and it sorts the different drug plans based on cost. So let me show you, you know, these are the different drug plans here. You can see they have their different premiums here. Some insurance companies have multiple plans. This one has 3. Some have deductibles, some don't, depending on the type of drug. Tier 1, Tier 2, Tier 3. You'll pay certain amounts after the deductible. Uh, and then in the coverage gap, if you ever reach it, you'd pay 25% the cost of the medication. So again, go to medicare.gov, medicare.gov plan finder, and we can help folks figure out, a good plan for them. Each year they change their formularies sometimes. And if a drug goes off formulary and you didn't switch your plan or know about it, then you could be stuck, paying a higher amount for the drug than you need to. All right, let me switch back to this. There is what's called the Extra Help Program. So if your income and assets are below these amounts, you could qualify. Now, keep in mind, if you're still working, they don't count all of your income. They count essentially half of what you earn. So even though you may earn more than this, there are a lot of deductions. So don't count yourself out if you see these numbers. Essentially double, you could still qualify if you have double the income if you're still working. Okay, so now let's look at Medicare Advantage plans. These are HMOs. Part C is where it's described. We have 55 plans in Santa Clara County. Essentially, plans are paid per person per month by Medicare to take care of a person's A and B benefits. So when you sign up for Part C plan, a Medicare Advantage plan, you're assigning your A and B benefits over to the HMO, and you get a new card, and you take that card to the network providers in that HMO. All of the plans have drug coverage included in it. So you don't have to buy a separate drug plan, but you want to make sure that your drugs are on the formulary of the plan. This opened up for the first time ever for people with end-stage renal disease. You have to live in the plan service area to sign up, though. And you have to have both A and B to get one of these. As a side note, they also cover hospice. They didn't used to before, but you have to use their network. And Part C companies are allowed to limit your access to Part B medications. It's called step therapy. So if you have an expensive Part B covered drug, they can say, well, no, you need to use this other drug first. If it doesn't work, then you can use the one that was prescribed by your doctor. You can appeal this. Your doctor can appeal it, though. So it really depends on how their appeal process goes. You can look at their star ratings to see how good they are about appeals. With ESRD folks, this is a big deal, to keep in mind, because you do use a lot of immunosuppressive Part B covered drugs. Changing a Medicare Advantage plan or joining one or dropping one is done once a year. Well, there are two now, but the annual enrollment period is October 15th through December 7th, and the enrollment takes effect January 1st. So we had that, last year. If you have second doubts, if you have cold feet about it, in January through March, you can change your mind. Sometimes you can enroll in these if there are what are called special enrollment periods. So Kaiser has a 5-star rating. Someone can join that at any time of the year. There are some plans that are called chronic special needs plans. If you meet a certain chronic condition like having diabetes, you can join a plan anytime as well. Now, the important aspect and the big difference with these plans is that you have to use the network of doctors that typically your primary care doctor is with. So you pick a primary care doctor, they're in a certain medical group. You will then use that particular medical group going forward. You can change your primary care doctor to another medical group. That won't take effect until the next month. And then you have access to that medical group So for you all, it's really important to check before you join one of these that your providers are take that HMO, but also are within a particular medical group, because you can't go to other medical groups unless you get prior authorization by the medical group, by the plan. There are different levels of approval with these Medicare Advantage plans. They do have deductibles and co-pays. But the good thing is there is a maximum out-of-pocket limit now for out-of-pocket costs, which I'll look at. Medigaps cannot be used with these, by the way. Those are two separate paths, okay? Medicare Advantage plans, though, they have a lot of extra benefits. So let's take a look. So we have these sheets and charts for Santa Clara County. Other counties will have their own. It's set up in a different way, maybe, but what I want to show you is how to read this sheet. So if you go to, we'll just look at the top here. We've got the plans at the top. Here, this is AARP, Medicare Advantage Secure Horizons. This is the plan ID. This is their star rating. Highest is a 5, Kaiser, and then a bunch of 4s and 3s and halves. The important one here too is contracted network. It's not a comprehensive list, but here they contract with Northern California Advantage, Physicians Medical Group of San Jose, SCIPA, San Jose Medical Group, and Sutter PAMP. So if you're in one of those groups and this might work. This is the premium, $101. That's the highest premium for Medicare Advantage in Santa Clara County. And here's the out-of-pocket maximum, $5,900. They vary. This one's $4,000. This one's $3,400. The PPO, the one PPO in our county, where you can go in network or out of network, has the highest out-of-pocket max. In network, it's still really high. They have their own costs for hospital care and for mental health and nursing facility care. Down below are the co-pays or co-insurance for these different services. So for renal dialysis, a lot of them are charging 20%. So you don't know what that is. It's a negotiated price between the plan, the medical group, and the facility or the dialysis center. This one's charging 50%. This one's $30 under alignment. Now, once these co-pays or co-insurances add up to this out-of-pocket amount, in this case, $2,900, then you don't pay any co-pays thereafter for the rest of the year. So this is a really nice, it's a really nice protection if you join one of these Medicare Advantage plans. And then they do have extra benefits, like I said, extra and routine services. Some of them cover some type of chiropractic, acupuncture, routine eye exam, hearing, some podiatry, health club, and some transportation benefits outside of an ambulance. So like this, no cost, 12 one-way trips per year. So this is just the first page. The second page shows you their medication charges. You'll notice that Part B covered medications, 20%. We know those Part B drugs can be very expensive, but Part B is limited by the out-of-pocket costs. It's not considered a Part D drug cost. So this is the most you'll pay for both medical, hospital, and Part B drugs for the year. Okay, some charge 45% for immunosuppressives. Again, we have a lot of different plans with different networks. We've got Kaiser here, Kaiser Senior Advantage. This is available to the public. Some folks have retiree Kaiser plans. They might have different numbers because they're negotiated through the employer. But this is the plan that has the most people in our county. They have their own co-pays, and out-of-pocket costs. Kaiser has kind of lower, I should say, Part B covered drugs. Yeah, so they charge $0 to $47 for theirs. This one was surprising, nothing. So these are your Medicare Advantage plans. As I mentioned earlier, there are what are called chronic special needs plans. So these are plans if you have a certain condition. I think folks might have diabetes. So if you want the Anthem plan, but you're kind of limited, you're going to be in the CareMore network. But you can join these anytime if you have these different conditions. Okay. All right. So that just gives you an idea of Medicare Advantage plans. Sorry, I'm going over my time quite a bit here. I just wanted to go over that. And this last chart, which you'll have sort of, a comparison of, what are the pros and cons of having original Medicare with a Medigap or a supplement versus Medicare Advantage Part C. So as far as access to physicians, of course, original Medicare, it's so much wider. Medicare Advantage, narrower. It could work for you if you're happy with that provider group you're with. Prior authorization. There's less with original Medicare. There's more with Medicare Advantage. That means you need prior approval for some things. There was a study done by the Kaiser Foundation where 4 in 5 people are in a plan that requires prior authorization for things like durable medical equipment, Part B drugs, skilled nursing facility stays, and inpatient hospital stays. How much it costs. Generally, Medigap plans will cost slightly more for more coverage. Medicare Advantage plan premiums can be much less, $0 to $101 this year. But we all know the flip side of that, the other side of the coin, are annual out-of-pocket costs. So I'd say if you have a Medigap, like Plan F or Plan G, and you're using a lot of services, you're going to save on out-of-pocket costs. Because let's just say, someone with a disability gets a Plan G. This is not something that an ESRD person can get, but I'm just showing this is an expensive. This is the best Plan G for someone with a disability. That's about $2,400 a year, and that is the most they'll pay in out-of-pocket costs, except for the deductible. So let's say $2,600 is the most you'll pay, and you won't see a bill. Whereas with a Medicare Advantage plan, the out-of-pocket maximum could be as high as, like I showed you, typically $6,700 down to $1,999, unless you're in that PPO. So, so if you're going to have dialysis often at 20% plus other things, you might hit that maximum out-of-pocket. The G plan could save you a lot of money if you can get it. Underwriting. Now Medicare Advantage plans are open to anyone now. Medigaps, unless you're healthy or you have an open enrollment period, you can't get them. And again, it's limited to people over 65 with ESRD. There are no extra benefits unless you get a Medigap. You get 365 hospital days extra. Some plans offer dental, vision, fitness. But the Medicare Advantage plans, that's sort of their draw, are these extra benefits that you might have to pay for if you're with original Medicare. Some people ask about emergency and urgent care out of the United States. Some Medigap plans cover those things. Medicare Advantage plans, almost all of them cover emergency and urgent care out of their network areas. So lastly, again, apologize for being over, but watch out for fraud and abuse. Guard your Medicare card. Avoid things like free genetic testing. What they're after is your Medicare number. If they get your number and they'll sell it, maybe work some unscrupulous provider will bill Medicare. And before you know it, you can't have access to that service, that wheelchair, that device. So guard your card. If it's too good to be true, it probably, it may not be worth your while. Just as, you know, the previous president had mentioned a $200 Medicare card. That was enough to get scammers out there. Even though it never happened, people were getting calls about their Medicare $200 benefit. So it's really important to, Medicare is never going to call you. Social Security is never going to call you unless you initiate it. So don't give any information out like that to people purporting to be from those organizations. Same with COVID testing scams. And we encourage you, whether it's original Medicare or Medicare Advantage, to check your statements for accuracy. I mean, are they is it the right diagnosis? Is it the right bill? And we have a senior Medicare Patrol liaison with our organization who can help investigate. Her name's Nancy, and she works closely with Stephen and let us know if you sense anything out of the ordinary. They work through the internet, social media, text, phone. I think you've all probably, you know, screening your calls now. So just please be aware. Again, here's our information. And with that, let's start answering some questions.
Oh, well, thank you, Marcelo, for you know, unpacking a lot of this important Medicare material. You know, it's a lot of information to absorb. So you know, I'm glad that we still have a lot of folks here. I know we did go over time. So what I'm going to do, Marcelo, if it's okay with you, I know we have. I was trying to answer most questions as best I could. If I can quickly type out an answer, sometimes it's a bit challenging to type out an answer. So let me go ahead and ask some of the questions that I didn't answer via text, and then maybe you can just rapid fire off some answers. I know will be tricky, but
Sure.
Let's see if we can chip away at some of these. So one person asked, my brother is undergoing dialysis because of polycystic kidney. I am going to be their donor in the kidney transplant. I will be traveling to India for the procedure in the next 2 to 3 months. How should I prepare myself before the transplant and after the transplant? Should I need any type of registration in the US, which will help me in the future? And that's kind of the question. And I found that a very interesting question. So I figured I'd save that for you if you had any insights on that question, please.
Well, there's a lot to unpack there. You know, I don't know much about the brother. I would suggest we meet offline, but just know that Medicare it will only cover folks if treated in a Medicare facility. There's nothing outside the United States that they will touch, as far as I know. So I think we need to talk about that one offline. So feel free to reach out. Maybe Stephen, you could provide a contact for that person.
Certainly. And hey, Marcelo, you know what? I answered a question earlier that maybe this will help clarify. So for folks that have a Medigap policy, like the F plan, for example, I know that they list that they'll cover out of country, what's the language? Foreign travel emergency. So I just wanted to make sure that the situation or the question that I asked you, I'm going to guess that that's not counted as an emergency, then traveling to another country to do this.
No.
Okay. Okay. So just an emergency. In other words, if I'm in India on vacation or whatever, and I have some type of emergency, I get hospitalized. I would initially pay those hospital fees, and then my Medigap or supplemental policy would then reimburse me up to a certain amount. Is that right? I just wanted to make sure I explained it correctly. Okay.
Yeah. For emergency care in foreign country, and I believe the limit is the first 2 months of travel. But yes, so sometimes medical records and the claims would have to be sent to the Medigap company.
Got it. Okay. Thank you. And there was another one. In California, are we eligible for Medicare if we're under 65, not on dialysis, but are stage 5 kidney disease?
So you're eligible for Medicare if you have if you're not eligible for if you're not eligible for ESRD Medicare, the only other way under 65 is if you have a disability and have received SSDI payments for 24 months. The only other way might be if you're in an emergency disaster area, but that hasn't been. I mean, that's in Montana where there's a county that was affected by asbestos. But no, if you don't qualify for ESRD kidney Medicare, you would apply for Social Security disability, but then there's a waiting period of essentially 29 months, 5 months plus 24 months of receiving disability insurance payments.
Hey, you know what, Marcelo, that kind of answers that touches on this question somebody had. And let me see if I can read through this without wrecking it. If a person younger than the age of 65 is determined by Social Security that they no longer qualify for coverage after the transplant 36 months later, and they feel that they should not be taken off, what can I do to keep myself on continued coverage? I have other health issues that keep me from working, doctor letters, family and friend letters, the Social Security. What else can I prove? What else can I do to prove my other disability? So I think you were touching on some of that on that last answer. Maybe
So right, as I mentioned earlier, the Medicare says if you've had a transplant for 3 years, it's then you're taken off Medicare. You can still have Medicare if you're deemed to have a disability, like I mentioned. That's a Social Security process with your doctors. Essentially, they're trying to see if you cannot have gainful employment according to their amounts. So, outside of that, if you can't get that, then there is Covered California is what people might call Obamacare. It's getting Medicare through an insurance exchange. So it's coveredca.com. Let me just pull it up. So this is the Covered California website. So here you can get insurance without any questions. But there are enrollment periods to be aware of when you can sign up. If you lose other coverage, typically you get a special enrollment period to get into a Covered California plan, and you can get subsidies that help depending on your income. You can also buy private insurance, but and then also Medi-Cal if your income is low enough. But I'm afraid Medicare after ESRD, unless you have qualify for disability, you aren't going to get Medicare again until 65. Yeah.
Thank you, Marcelo. And here was a good
Okay.
one. Maybe this one may be valuable to some others. Actually, it probably is. I have a good employer coverage, and I'm 57 years old. I'm at stage 4 and might need a transplant before I turn 65 years old. Is there any advantage to signing up for Medicare before I turn 65?
Well, you know, it's a if your doctor thinks you qualify and you sign up, well, let's see. If you have a good health plan, I suppose, with your employer, you have 30 months to decide. You could use your employer plan without Medicare. And if you get the transplant, having Medicare, yeah, I think there's a situation where somebody did, had a transplant, didn't have Medicare, just used their employer coverage. So it really depends on employer coverage, what your prospects are for health and work, continued work. Medicare will only pay the immunosuppressives if you have Medicare at the time of the surgery. But if you have other ways to take care of that, then I guess you have options. It's hard for me to say. It really depends on the plan and your situation. So, I'm sorry I don't have such good advice there.
Is that almost? We had a lot of questions on, what should I do? Is that like a similar question when folks ask, which is better, traditional Medicare or Medicare Advantage? Is that similar to one of those questions? I know we get asked those at every presentation. Which one is better? Which is tricky to answer.
No, yeah. To be honest, that's a difficult question. It's a little different than Medigap, Medicare Advantage. Using the employer plan versus going on Medicare. There are different aspects to consider, but maybe we can talk about that offline too, and maybe we can help parse through that as well.
Okay. Yeah, it sounds like that one would be appropriate for one of our, for perhaps a one-on-one counseling session, which, by the way, folks, maybe now's a good time to remind everybody. So the HiCap program, we do these group presentations, to kind of give an overall general, to pass along some overall and general information. And then for someone that has, some unique questions, we do offer free, objective, one-on-one counseling all the time. We essentially do them Monday through Friday. We have a bunch of different HiCap certified counselors. It's not just Marcelo and myself. We have upwards of almost 40 different counselors within our county that are accommodating both phone counseling and even counseling in a virtual environment for those that are comfortable in this type of environment that we're in now. So certainly reach out and give us a call. And again, I'm glad I had folks asking about some of the materials that we were going over. So the PowerPoint slide deck that Marcelo was zipping through, I'm going to be sending that out to everybody. Or actually, I'm going to forward it along to Deborah, who has access to your email when you registered, and she'll go ahead and forward on the slide deck, our 2021 consumer guide, which includes all of all of the prices for Part A insurance, Part B insurance. We have unique files for all of the Medicare Advantage plans available in our county, Santa Clara County, some of the Medigap or supplemental plans that are available to folks in our county, the drug plans. And I'm also going to include some extra supplemental materials that are specific to ESRD folks. So thank you for taking the time with us. And let me see, Maybe we have enough time for one, maybe two questions, Marcelo. There was one interesting one, which I could probably also use some clarification. I kind of spaced out on this. And it has to do with Medigap companies not offering plans to those under 65 with end-stage renal disease or even history of a transplant. So I think the question has to do with the medical underwriting or health screening questions, and maybe even perhaps some of the guaranteed issue rights that are available to us in California.
Yeah, so that's right. Medigap companies will not offer those under 65 with ESRD any type of plan. If a person has a transplant, you know, even then, it's not successful till after the 3rd year. So, and by the 3rd year, you won't have Part B, and you need both A and B to get a Medigap. But if after the 3rd year you happen to have Medicare due to a disability, you could get a Medigap after a successful, having had a successful transplant.
And I don't know if you saw this last one in there.
Oh yeah, I see it here.
Okay.
I'll go ahead and read it. If you're over 65 and have a transplant, does Medicare stop paying for immunosuppressant drugs after 3 years? And if I just want to, could you, if you're, I didn't catch if that was over 65. Let me just see.
Here, let me get back to it, Marcelo. I'm sorry.
Okay.
I know I got rid of it. Yeah, if you are over 65 and have a transplant, does Medicare stop paying for your immunosuppressant drugs after 3 years?
No, after 65, you qualify for Medicare based on age, regardless of your condition. ESRD and will cover your immunosuppressant medications. Yeah. So no, Medicare won't stop paying if you're over 65 with Medicare.
Thank you, Marcelo. So thank you all for bearing with me. I tried to get through the bulk of the questions. I'm certain I missed some. I know I was kind of jumping around looking in the chat box and the Q&A. I'd like to thank you all for being very engaged and present with us this afternoon, but now may be a good time to answer any closing questions, Marcelo, maybe the next few minutes or so.
Sure. Okay.
Okay. So let's see if we can try something new. We can have folks, I know there was somebody that had a variety of questions, but now is a good time if you would like to voice your question. I believe we should be able to unmute you. Otherwise, again, feel free to drop them in the chat or Q&A. And it looks like one just came in. Maybe it's more of a comment. It sounds like you don't really benefit from ESRD coverage unless you get a transplant after 62. I'm not too sure. Yeah, maybe that's just more of a comment. But I know we had one person that was asking a variety of questions, and let me see if we can get them to voice their question if they're still here. And Ellen, are you still here? I know you had some questions that were kind of all over the place, and we can certainly let you voice your questions, make sure they get answered. If they did not already get answered throughout, let me see.
I'm not sure if it can be unmuted though, Stephen.
Yeah.
Yeah.
Okay, yeah, so I cannot unmute. So maybe let me see if I can go over them. Or maybe Deborah might be able to unmute Ellen with your...
Yeah, I just got unmuted.
Oh, okay. Okay, Ellen, so go ahead. Nice to hear you.
Thank you. I just wondered in terms of when a person is hospitalized, they have Medicare, but then hospital is saying ready to be discharged tomorrow, but the person feels that they are not medically ready to be discharged. Now, which part of Medicare do you need to have? Or it doesn't matter. Once you have Medicare, Medicare can interview the person and get a second opinion in there, second party.
Yeah, so there's a group I don't know if you can see it on my screen, but it's called Levanta. They are the QIO, so they help with early discharge issues. And it's normally in people's paperwork, but if you feel like you're being discharged early from the hospital, you can call them and they will look at and hold the appeal, the discharge off until they've come to a decision.
But you need to have Medicare.
Yes, this is assuming you have Medicare Part A and you're an inpatient.
Okay.
Yeah.
And also, is there training from Social Security or HICAP for doctors regarding quote unquote, blue book on medical conditions? Because I ran into problems with the kidney department in a medical setting where, I was trying to tell them about Blue Book. It's like Blue Book prices, like it's stroke. There's 7 or 12 levels of strokes. And the doctor rated it as, stroke level 2. Forget it. You're not going to get the Medicare and Social Security disability. And I found out, unless it's through the social worker who specializes in kidney disease or terminal cancer illnesses. So can you guys kind of look into maybe having a training sessions for the hospital doctors?
Oh, well, that's a little bit out of our wheelhouse. We aren't trained in the eligibility of
the coding.
Right. And so Social Security, while determining disability with Social Security, there are a lot of factors that I'm just not simply trained in. So I'm sorry, I can't answer that.
Because I was helping out with the doctors, nurses in terms of the paperwork. And it's really, I should not have to do it. You know what I'm saying?
Mm-hmm. Yeah.
And you guys are the ones that trained me. So, yearly when I was working. So I was just wondering.
Okay. I don't know if there are any legal groups that help with achieving that. There's Bay Area Legal.
Or like Asian Law Caucus or something like that. I can check.
Right.
I don't
Yeah.
And you were talking about Medigap insurance. We had training through health insurance that came out to our facility, and point blank asked them ESRD or any kidney problems. They says no, we will not cover, let's say, cancer or certain chronic diseases to have. So they're not mandated to accept over 65 to supply any insurance.
Which insurance are we talking about?
Let's say to cover, the Medigap insurance that you're looking for, and they're not. This insurance, was talking to us about coverage and saying how great it is. The point blank, I asked, okay, if it's like dialysis, oh no, we won't touch that. Okay, cancer, we won't touch that. So there were different, so they're not mandated to accept. So it's very hard to find after that session. It was almost impossible to find any insurance, no matter what the cost is monthly.
Well, when it comes to if you have Medicare A and B and you're over 65, and you're able to get a Medigap with when Part B starts for the first time, you have 6 months to get a Medigap plan without underwriting. And depending on the plan, the way it works is, if Medicare pays, its portion. If Medicare says we're covering this, we'll pay our 80%. Then the Medigap company must pay, according to this chart, whatever's left over. The rules are clear. You know, I think there's confusion where some doctors might, you know, some people say, oh, well, my provider doesn't take that insurance. What they're probably talking about is Medicare Advantage plan, because you saw the whole list of these Medigap plans. I mean, they're companies from all over. Again, it's very standardized, and the doctor provider offices, they don't care what Medigap you have. If Medicare pays, the Medigap will pay its portion. So you always have to ask when you're in the Medicare world, which type of product are you talking about? Supplement Medigap, Medicare Advantage? Are we talking about a drug plan, and so forth? So
I think it was a supplemental versus Medigap.
yeah. So yeah. So
Supplemental, they're not forced. I mean, they can refuse a patient to have that.
that's right. There's, you know, unless a person applies during special times, open enrollment, 6 months when Part B starts is when you can get a Medigap, no questions asked. You don't have to answer the medical questions. After 6 months of Part B starting, then you have to answer the medical questions. If you're healthy, of course, they'll take you, but if not, then they can say no. I should say that if you try out a Medicare Advantage plan for the first time, but that's when you turn 65. There are various rules that trigger somebody's ability to get a Medigap. So if you're over 65 and you're in a Medicare Advantage plan, this is just an example, and the Medicare Advantage plan sends you notice at the end of the year, we're going to raise our copays or we're going to take away certain benefits. In California, that triggers a chance to get a Medigap without any underwriting. And it would take effect, you know, the first of the year. There's other nuances, but it just gives you an idea that there's certain times that trigger a chance to get a Medigap after 65 for you folks without underwriting. So, you know, if you're in a situation where you want to get out of a Medicare Advantage plan, check with us, because we look at that at the end of every year to see if a company's or plan has done something to trigger that right. They're not going to inform you, so kind of have to act on your own to exercise your right to a Medigap.
Okay, and one last question. If it's Medicare with a employer plan that's a HMO, I noticed that there's advertisement, and I noticed your chart saying it covers special transport, dental, etc. But I checked with one hospital plan, and they said, well, no, we cover for our retirees, but there's no such thing as dental coverage or transportation.
Yeah, so retiree plans are often a little more robust in terms of, you know, the cost, the co-pays and things like that. But so retiree Medicare Advantage plans are different than what I'm showing you here. These plans are plans that anybody could get. Some retiree plans, they don't offer transportation. You know, some of these don't offer transportation. So it really depends on the company and the plan. You have to look at your evidence of coverage, whether it's one of these or through your employer plan, to find out what is covered. Yeah.
Yeah, and the nice thing is that this Medicare Advantage chart that we're all looking at, we do our best to include those companies that do offer additional benefits, like, you know, transportation, maybe to and from an appointment or just transportation in general, maybe over the counter type of stipends. Maybe they have an additional vision benefit that they're offering. Maybe it's at an additional cost, but it is all within this a Medicare Advantage sheet. And this is one of the files that will be included in the Medicare Consumer Guide. So we did do our best to include all of Santa Clara County offerings. If you spot, and I would encourage, if you see something that's on there, if let's just say AARP says that they're offering some type of extra benefit, I could have certainly made a mistake. I know I'm somebody who helps put together that form. But I would encourage everybody to give them a call to confirm if you need to. And, if you want to let me know, that'll be very helpful. And if you are in need of, again, a one-on-one counseling session with one of our high-cap state certified counselors, I just put our telephone number and our website in the chat box. So feel free to utilize it. Not only that, in all of the materials that we're going to have Deborah relay over to you guys, it's going to have our contact information all in there. So if you do have additional questions, it looks like we're going to wrap things up now. We went well beyond this Sunday afternoon. So we will try to wrap it up now, be respectful of everybody's time. And if you can, please give us a call at 408-350-3200. You can select what language you wish to use, and then push option number 2 for the high cap program here in Santa Clara County. And in case we don't answer, please feel free to leave a message. We're calling everybody back to make sure we can take care of you, whether we answer your question over the phone or, we send you away with a one-on-one counseling appointment with a different certified counselor. We will certainly do that. So please give us a call and we'll be glad to help. Deborah, I'd like to thank you again for inviting us today. I hope everybody found some value in this meeting. Let's be honest, Medicare alone is very complicated. Medicare, when it comes to end-stage renal disease and kidney patients, it adds on an extra layer of complexity. So thank you, Marcelo, for helping us out and informing us. And Deborah, I'm going to click send on the email with all of these materials as soon as we disconnect. It's all ready, actually. But Deborah, Marcelo, any closing words before we wrap things up? Thank you again.
Marcelo, great presentation. I can't believe you can make Medicare interesting. That's an
Thank you. Yeah, I know there is a lot of information. I just want to say, if you need help with the charts, we're here to walk you through it, and we'll do some research for you too if we weren't able to answer some of your questions. But thank you again for having us, and yeah, you're very welcome.
Thank you, everybody. And yeah, it looks like there was even a testimonial. Somebody says that they make an appointment with us every year to do maybe their Part D drug analysis review, and we save them money. So I think that's excellent. Welcome back. Good to see you again. And again, I implore anybody here today to give us a holler. If you have any simple Medicare question, there's no such thing as a simple Medicare question, but if the answer is simple, we'll certainly give it. If it's complex, we'll take the time to give you those answers. So I would implore, if you do have upcoming questions in the future, don't hesitate and give us a call. The number was in the chat. It's going to be on all the materials you'll be getting soon also. So thank you all again. I do hope you all enjoy the rest of your Sunday afternoon. Thank you, Deborah. Thank you, Marcelo.
Thank you so much.
Thank you, guys.
Okay, thank you all. Take care.
Thank you.
Thanks,
Bye-bye.
everybody. Appreciate it very much. Thank you, Steve. Thank you, Marcelo. Thank you, Deborah. And thank you, Milda, for putting our first podcast together.
Thank you so much.
And thank you all the participants who are listening today. And I know it's confusing, like we mentioned, but we're going to try to supply all the materials as possible to help you walk you through this Medicare regulations and Medicare enrollment. So thanks again, everybody. Enjoy your Sunday, the rest of your Sunday. And if you get the opportunity to get the shot, take the shot.
Don't forget, there's a BAAKP meeting coming up each month. So take a look, sign up on the website at baakp.org.
Right.